Everyone, it's Dr. Rick, and I wanted to promote my Saturday Zoom call. Going to be from 11 to 11:30. I try to get 2 cases in, maybe 3, but if you think you have a good case, give me some data, send it on in, contact me through my website, Herbal411. Hopefully I can use your data anonymously and give you an idea about what I would do if you did see me in clinic. So this first patient that I found, it's going to be a good case, is a 55-year-old who just underwent a stent. Stent is when you take a coronary artery, a heart artery, and you pop it open, you put some steel in there, and it keeps it open. Sometimes you'll have drugs that will keep it dilated, sometimes not. But this is a guy who was following with his doctor high cholesterol, elevated blood pressure for a couple of years. Now, CT scan, which is a calcium score, was done in the past, and it showed mild development of plaquing. And that's just a term. That means there's a little bit of calcium in his heart somewhere on one of the blood vessels. I think it was a left anterior descending. And a follow-up CT scan after really not getting anywhere with using medicines and occasionally dropping into healthy lifestyle and healthy eating, the next CT scan showed definitely worsening compared to the first one. So with that, there was the push to get a cardiac catheterization. Now, cardiac catheterization is somewhat invasive. In fact, there's a little bit of risk when you do have a cath. That's when they go through the groin. They send a little catheter up here, send a squirt of dye, and then they take pictures of the outline of how the blood vessel looks in the heart with the dye. That's the most accurate way, aside from breaking your chest open and looking at the blood vessels, that you can figure out where there's a narrowing. And he had a narrowing, and that's why he had the resultant stent put in. So now he's got 100% clearance, meaning that they opened up the narrowing, but he also has a stent. So that carries with it some life-saving graces, but also you're kind of obliged to be taking medicines for the rest of your life. So I would say that it's a good win. However, if all we're going to do is put a stent in, well, you know what? I probably shouldn't give this away. So if you show up at the Zoom, and I'll put the link down below, on Saturday, 11 to 11:30, I'll give you the answer. Sorry I had to hold back the spoiler, but there are ways, short of what the cardiologist did, to make sure that it doesn't happen again. Because if you look at the average statistic, a stent, if you change nothing with your health, will usually last you about 6 years before the next stent comes in. And bypass, if you do have bypass, sometimes 10 to maybe 15 years, unless you make a lifestyle change, even with medicines. So it's important to understand that if you've been given a second lease on life with a stent or 2 and or bypass, you gotta kick some ass as far as lifestyle change. You cannot just get back into things and continue life as is with a whole bunch more medicines and steel. So the definitive change that happens with bypass is you gotta rehab this broken sternum and get back to slowly getting activity. So I think most people understand and remember that threat, that they don't want to go back to that, so they make lifestyle changes. The stent people, sometimes you get a stent and later that day you're discharged with no pain. And it's like, well, I guess I'm okay. So the inspiration to make lifestyle change is limited unless you have the cardiologist put you through cardiac rehab, nutritional change, mind-body medicine, and all that other stuff. But unfortunately, if you have a stent, I don't think that stuff is covered. I believe you actually have to have a diagnosis of a heart attack before all that stuff is covered. And if you have a stent just for angina, technically it's not a heart attack. So you're on your own as far as making those lifestyle changes, unless you hire one of us as far as a lifestyle coach. Now that's investment out of the pocket. I keep on talking about this all the time, but what would you rather have? A stent and then more stents coming, possibly a heart attack? Or do you want to change your life so you reverse the diabetes, get rid of the blood pressure medicines, get rid of the cholesterol medicines, and live life? So I'm still looking for the next 2 cases. Get the link, and when you show up at the Zoom conference, I'll ask whoever has a case, and I'll see if we can kind of short tail it so it fits within the realm of the 30 minutes. You can always just show up at the event at the Endorphin Effect in Bartlett, 11 to 11:30, and I do have a conference after that, so we have to cut it short exactly at 11:30, but if you're coming, you can certainly work out if you want to. Or you take the Zoom link down below and you show up when the Zoom link goes on, and if you're lucky enough and I haven't had enough cases, you can chime in and I can ask you about your case. If it's complicated and I can't figure out a direction for you, then I'll present it at the Grand Rounds on the 27th. See you at the conference.